Everyone is discussing about coronavirus these days. So, what is coronavirus? They are a large group of viruses found in both animals and humans. Some coronaviruses infect people and are known to cause illness ranging from the common cold to severe diseases, such as Middle East Respiratory Syndrome and severe acute respiratory syndrome. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. Detailed investigations found that severe acute respiratory syndrome was transmitted from civet cats to humans in 2002 and Middle East Respiratory Syndrome from dromedary camels to humans in 2012. There are several known coronaviruses that are circulating in animals and have not yet infected humans. However, as surveillance improves around the world, more coronaviruses are likely to be identified. So, what is novel coronavirus? A novel coronavirus is a new strain that has not been previously identified in humans. It is now called as 2019 novel coronavirus as it had not previously detected before the outbreak was reported in Wuhan, China in December 2019. So, can medical mask protect us from novel coronavirus? It can help limit the spread of some respiratory diseases, but using a mask alone is not guaranteed to stop infections and should be combined with other preventive measures. So, how should we keep ourselves safe? Frequently clean your hands by using alcohol-based hand rub or soap and water. This eliminates the virus if it is on your hands. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue, and then clean your hands. This prevents the spread of germs or viruses. If you sneeze or cough into your hands, you may contaminate objects or people that you touch. Avoid splitting in public. Maintain minimum 3 feet of distance between yourself and other folks who are coughing, sneezing, and have a fever. When infected person with a respiratory disease, like novel coronavirus, coughs or sneezes, they project small droplets containing the virus in the air. If you are too close to them, you could breathe in the virus. Whenever possible, avoid touching nose, mouth, eyes and ears. Our hands touch many surfaces, which could be contaminated with the virus. If you touch your eyes, nose or mouth with your contaminated hands, you can transfer the virus from that surface to yourself. Carefully handle raw meat, animal organs and milk to avoid cross-contamination with uncooked foods. Eat only well-cooked food. Do not eat sick animals and animals that have died of diseases. If you have mild respiratory symptoms and do not have travel history to or within China, carefully practice basic respiratory and hand hygiene. And if possible, stay home until you are recovered. If you have fever, cough and difficulty in breathing, please do seek medical attention as soon as possible. Do tell your doctor if you have traveled in an area where novel coronavirus has been reported, or if you have been in close contact with someone who has recently traveled from China and has respiratory symptoms. Respiratory symptoms with fever and cough can have a range of causes, and depending on your personal travel history and circumstances, novel coronavirus could be one of them.